Good morning. My name is Sharona. I'm from Florida Hospital, Tampa. I'd like to thank SAGES for the opportunity to present here this morning. The title is Single Incision Robotics. Do we really need a robot, and what happens if we have one? Those are my disclosures. So you already heard this morning that the robot, we have it for several years now, and the adoption continued to increase, including in general surgery. So why do we have or need a robot? If you look at this for all surgeons as a spectrum, if there was a line there from open operation to a minimally invasive approach, and we have, let's say, Surgeon A. Surgeon A doesn't really do any minimally invasive operations. They do all open. That's the way they train. The habit is to have open operations. They have good outcomes. Why change it? Then you have Surgeon B, that still majority of their cases are done with open procedures. However, they may be open to some of the laparoscopic approaches like cholecystectomy that would do laparoscopically, but majority of the operation is still open. Surgeon C, however, does almost equal amounts of open versus minimally invasive, with a more tendency to adopt some of the minimally invasive approaches, but yet majority is, or close to majority, is still open. And finally, Surgeon D, who is a fellowship trained in MIS, all they know and think is MIS, and sometimes are uncomfortable to open and do an actual open operations. So those are just demonstrate 4 different surgeons with their experience and tendencies. Now let's talk about the operations. Still, we have some operations that, if you look across the country and even internationally, majority are done open. Whipple procedures, or pancreatic duodenectomy and cholecystectomy, those in majority of the places still done open. Lower anterior resections and other colorectal operations that are primarily done in the pelvis, also being majority of them open. Less than 20% of the colorectal surgeons really adopted laparoscopy. Same thing with esophagectomy and distal pancreatectomy, that although has a more established laparoscopic approach, we have many surgeons that still do them open. When it comes to cholecystectomy, and as you just heard with foregut operations, majority of those foregut operations, Nissens, Hellers, bypasses are done with minimally invasive approaches. So what does the robot do to the operations? It moves them along this spectrum from open operation to more minimally invasive operations. What does it do to the surgeons? Once again, it moves a surgeon who usually would do open operations to a more minimally invasive approach. Let's talk a little bit about the literature. Yes, there is not a great deal of literature out there for robotics like for conventional laparoscopy, but there is quite a number of publications for foregut surgery. We know it's safe and it's feasible. The same thing with liver surgery. Although we don't have lots of literature out there, no randomized studies, but we do know that it can be done safely with the robot. Robotic pancreatic duodenectomy, once again, no randomized trials, but it is found to be safe. It does increase the operative time, no question there, but in some cases can shorten the length of stay and has similar morbidity and mortality. As I mentioned before, for distal pancreatectomies, we do have an established laparoscopic approach, but still, when you look at the distal pancreatectomy, splenectomy done with the robot, it is safe by most hands. Robotic cholecystectomy, it is done safely and has a lot of literature about robotic cholecystectomy. Personally, I would not do robotic cholecystectomy when you can do it easily with reproducible outcomes with a single incision laparoscopy. However, you do need to train yourself with this new technology with some type of operation. Cholecystectomy is a very easy, less moving parts when you do it with the robot or with single incision laparoscopy. So for from a training point of view, I see the utilization of robotic cholecystectomy being done. But once again, it is safe. So when you look at the spectrum from open, big incisions to more minimally invasive operations, the benefit of using the robot is it provides you a safe approach. It does and can shorten the length of stay, less trauma to the patient, higher degree of dexterity, and better visualization. So why do we need a single incision robot? Let's look at that. This is the current platform of single incision robotics, and it's true, I wouldn't use it as well. I can do a smaller incision with the single incision laparoscopy, and the great thing that the robot adds to our operating room is the ability to have the wrist motion with minimally invasive surgery. But with the single incision robotics right now, you have the 3D and the HD, which you can also have with the laparoscopy, but you lost the wrist motion. So true, I personally would not use the system. However, when people look, and once again, there's some literature about cholecystectomy, including recent literature, that compare the robotic single incision cholecystectomy to the laparoscopic cholecystectomy experience. And what they found is that you can actually decrease the cost somehow with single incision robotic cholecystectomy when you compare it to laparoscopic cholecystectomy. And they also noticed that there's a very short learning curve, that after 12 cases, they actually could decrease significantly the OR time, the OR cost, and the anesthesia cost with single incision robotic surgery. Then there's another study that documented the learning curve when they compared the first 25 patients that underwent single incision robotic cholecystectomy as compared to the first 25 single incision laparoscopic cholecystectomy, and they noticed that not only that the learning curve is short, but it also decreased the operative time when compared to single incision laparoscopy. This is just to document that the learning curve is so short you really don't have one with robotics. And you don't have to be an experienced MIS surgeon to have similar outcomes. Now, this is the upcoming single incision robotic platform that is really, I would think, in theory, useful. It's not only providing you with 3-dimension and HD visualization, but it brings you back the endo wrist motion, which I think is essential for especially complex operations. It provides you access to all 4 quadrants. It has the boom, so it doesn't take too much room in the operating room. And at the same time, it now allows you to have the bed that moves with the robot, which then saves some time, because otherwise, when we need to have access to all 4 quadrants, we have to undock, dock, undock, and dock again in order to operate in different areas. So why do we need a single incision robot? And what happens if we have one? Well, if we have a robot in our hospital, then it moves all the operations toward a more minimally invasive approach. And what does it do to a surgeon? It moves that specific surgeon from a more open or less minimally invasive to more minimally invasive surgery. From my perspective, I do everything with single incision laparoscopy for all the easy, benign operations like Nissens, Hellers, giant idle hernia, cholecystectomies, just in the stomach, or any small bowel disease, right hemicolectomies. You can do all of those easily with the single incision laparoscopic approach. But how about to do it for complex operations? Wouldn't you like to do a single incision transhiatal esophagectomy, carrying the whole dissection up into the mediastinum, seeing the pleura, not touching the pleura, not getting into the chest, no chest tubes, small incision here, do the entire dissection, which now we do with multiple incision robotically, and an incision in the neck, just with one incision in the belly button and in the neck. And same thing for Whipple procedure. That will be a great, great advantage, and with quick recovery for patients, and obviously can go to adjuvant chemotherapy a lot sooner. Now, what this provides you is that the sky is the limit, and really I would recommend to to embrace technology and really embrace it as it relates to your skill level and your practice. Don't just embrace it because it's nice and neat technology, but if you really need it, if you can't do it with single incision laparoscopy, then adopt the robot because it allows you to do really fine work. Thank you.
Thank you very much, Dr. Ross.